My name is Evan Harmon. I am the Remote Patient Monitoring System Manager for the Baptist Health System. Remote patient monitoring allows patients to be monitored using a combination of software as well as clinical devices to ensure that they stay healthy at home. I'm responsible for the support and rollout of our remote patient monitoring solutions across the health system. So I do a lot of strategy setting with system leaders, work with clinical staff on finding new use cases for remote patient monitoring so that we can take care of our patients in the home as opposed to being on site. We are doing a lot of project work in both rolling out billing from a service line perspective, so we're doing some administrative tasks, we're doing those clinical use cases. We may be having discussions with care providers about what type of outcomes they're having from the programs that we do have in existence. I could be taking patient calls and complaints about the software. When you're using software like this, a lot of things go right, but sometimes things go wrong. We have conversations with patients about those. We do patient interviews to make sure that they are having a really good experience, and if there are opportunities for improvement, we'll work towards those. We're doing something innovative. So when you're doing something innovative, you do get to use that creativity, but you also get to kind of study what's going on in the market. So I do a lot of market studying and hearing about what other folks are doing. I think another thing about the role that's really important is you can see the impact that you're making with the patients. So you're working directly with those providers, you're working with the patients, and then you're hearing about the impacts, which has been really an exciting part about this role. I think the thing that I really like most about my job is seeing the outcomes from our patients. So we've been very fortunate to work with a lot of skilled providers who are ordering this on their patients, and we're seeing a lot of really good outcomes. So looking at those outcomes, being able to translate those into patient stories and understand how we're impacting them with their chronic disease state, but also seeing how we're actually impacting their lives. We have a really good relationship with JCTC. We've been able to bring students on who are completing their internship requirements or their practicum requirements and help them understand different sides of healthcare. And so we've been fortunate enough to actually, through that partnership, be able to hire several of those students on board following graduation. Overall, I feel that Jefferson Community and Technical College does a great job preparing their students for a career in allied health and in health information technology. Absolutely would recommend this career to someone. I think there's a lot of unique things that you can do in allied health, and I don't think everybody knows what those options are. You don't have to put yourself in one specific box. I think that there's ways to look outside of that box, think outside of that box, and get creative.